Welcome to Easy Treatment Healthcare Private Limited, your bridge to global healthcare. At Easy Treatment, our mission is to be your preferred healthcare partner, providing personalized and comprehensive medical assistance to patients worldwide. Our vision is to be a global leader in medical tourism, known for our commitment to quality, compassion, and excellence in patient care. At Easy Treatment, we cater to all patients, ensuring a seamless healthcare journey regardless of your location or background. Start with a simple inquiry. Contact. Visit our website for an initial consultation, where we'll understand your medical needs, preferences, and budget. We conduct a thorough assessment of your condition, discuss available options, and assist in scheduling appointments with top-notch healthcare providers in Hyderabad. Our dedicated team will accompany you to hospital visits, ensuring smooth communication with healthcare professionals. We provide continuous support throughout your treatment, from follow-ups to medication assistance. Even after your treatment, we're with you every step of the way. From post-treatment care to coordination of follow-up appointments, we've got you covered. Our comprehensive services include medical tourism, free medical assistance, appointment scheduling, medication and investigation support, second opinion services, and budget-friendly hospital selection. Our exclusive services includes organ transplant, joint replacement, robotic surgeries, neurosurgeries, heart and cancer treatments. For our NRI patients with parents in India, we go the extra mile. We support in carrying them to the hospital and ensure their safe return home. We welcome your loved ones with open arms, offering arrival support, airport transfers, and initial orientation. Experience hassle-free healthcare with Easy Treatment Healthcare Private Limited. Your journey to wellness begins with us. Contact us today at.
Good afternoon. Hello, I'm Karishma, welcoming you on behalf of Easy Treatment Healthcare. Today, we are hosting a webinar on understanding LASIK surgery as part of our Ask the Doc series. At Easy Treatment Healthcare, we are here to serve you by offering expert medical guidance and personalized support for all your healthcare needs. Whether you are searching of the best treatment options, attending our monthly free webinars, or seeking professional advice through our Ask a Question platform on the website, we are dedicated to helping you make informed decisions. Our goal is to provide compassionate assistance, ensure you receive the care, offer quick access to doctors, and support your treatment from start to finish. Welcome you and thank you for joining us. We extend a warm welcome to Dr. Advaith Sai Alampur. He has over 15 years of experience in the field of ophthalmology. He is the founder and managing director of Envision LASIK Center and practices at Sai Jyoti Eye Hospital in Hyderabad. He has completed a fellowship in cornea and refractive surgeries at Sankara Netralaya, one of the top 4 ophthalmic institute in 2020. He specializes in treating a wide range of eye conditions, including lasers, cataracts, glaucoma, corneal disease, and refractive errors. Excels in advanced surgeries like cortical LASIK, offering personalized vision correction solutions. We are honored to have him present this webinar. After the presentation, there will be an opportunity for all of you. You can just ask questions. So please feel free to ask your questions. Our doctor are here to provide the answer you need. Please, doctor, now you can continue further.
Hi, good evening, everyone, and thank you for the wonderful introduction, Karishma. So I'm Dr. Advaith Alampur, and I specialize in LASIK surgeries, and I'm the founder and managing director at Envision LASIK Center, Hyderabad. Uh, so first, let us understand what LASIK is. So LASIK is basically what we need to know is a cosmetic surgery, and this is basically done on youngsters who don't like to wear glasses, or who don't want to get into the habit of daily wearing contact lenses, where every day morning you have to wear the contact lenses and evening you need to remove the contact lenses. So in such patients, LASIK is the ideal choice. So today we will be discussing about these following topics, as you can see on your screen. The objective of the presentation will be talking about what exactly LASIK surgery is. We will be discussing about the advantages of LASIK surgery, who is actually LASIK ideal for, and a lot of patients keep asking us if LASIK is safe or not. So we'll tell you if the safety, uh, how safe LASIK is. We'll be talking about, and also we'll be understanding some side effects about LASIK, or if LASIK is painful or not. So these are the frequently asked questions that we get from most of our patients. And at the end, we'll be busting some myths about LASIK surgery. And then after that, we'll be having our Q&A session where any doubts, anything regarding LASIK surgery or eye treatments per se, you can feel free to ask. So what exactly is LASIK eye surgery? Now, LASIK is a terminology. I think most of us are not new to this terminology. So basically, LASIK is a procedure basically done on the front surface of the eye. Now, the front surface of the eye is basically called the cornea. It's basically a transparent structure. So LASIK is a procedure that is done where we alter the shape of the cornea in such a way that the light rays are focused on the retina. Retina is basically the nerve of your eye. Now, patients with glasses, normally the light rays are not focused where it's supposed to be focused, for which we have to use glasses. So in such patients, what we do is we alter the shape of the cornea in such a way that the light rays are focused on the retina, so that you're able to see clearly without any glasses. So this is basically done to reduce a person's need for any glasses or contact lenses. So now, uh, who is LASIK for? Normally, LASIK is done for patients who want to come and they want to get into some jobs like Navy or Army or Railways, where the glasses are a hindrance. It is for people who don't like to wear glasses at all because they feel like aesthetically they don't look good with the glasses. For patients who are like celebrities or actors or dancers or sports persons, where definitely glasses is a hindrance in the profession. So such patients, the procedure of LASIK is life changing. Like I said, now LASIK is, you have a wow effect, where because now anybody with glasses, I think they understand what the difficulty is with glasses. As soon as you wake up in the morning, the first thing that we need to do is just to go and look for your glasses, or just go and wear your contact lenses. So LASIK, you have a wow effect where the very next day you'll be able to see clearly, and you don't have to look for your glasses. You can actually see the world clearly without any glasses. So let us talk about some advantages of LASIK surgery. Now, the LASIK technique itself, the entire procedure lasts less than 10 minutes, and it is quick and an effective procedure. Now, the LASIK surgery is basically done without any injection. Basically, what we do is we put some anesthetic drops. So on putting the anesthetic drops, the eye becomes numb. So throughout the procedure, you do not feel any pain as such. And because of the technical advancements that has been incorporated into the LASIK technique, this basically eliminates the significant risks, basically to any visual impairment. So most of the procedures, more than 98% of the patients undergoing LASIK surgery have more than satisfied results. Now, one of the common questions that we ask is, doctor, after undergoing a LASIK surgery, do I still need to wear glasses? No, absolutely, you do not need to wear glasses. The whole point of LASIK surgery is to reduce your dependency on the glasses so that you will be able to see without any glasses. Now, however, what you need to understand is our body undergoes some aging changes, like how your hair becomes white, like how you get wrinkles on your face. After the age of 40 years, we all get reading glasses. Now, this reading glasses is something that even if you do not undergo LASIK surgery, you will get reading glasses and you might have to wear reading glasses. Now, who is ideal for a LASIK surgery? Now, most importantly, the age is an important criteria where you have to be over the age of 18 years. Basically, what happens is around 18 years is when your refraction, that is your power, gets stabilized. Like how your height increases, it stops after a certain age. Even the number also, stops to increase after a certain age. So 18 years plus you need to be. And it is also important that for the number has not changed. Like for example, if your class number is -3, for last 1 year, the number should be -3. If the number has changed, that means the power is not stable. Then ideally in such instances, it's best to wait for 6 months to 1 year to wait for your number to stabilize, and then you can get it done. Your eyes obviously need to be healthy. We do not want any conditions on any inflammatory conditions or any infection in the eyes. You should not be pregnant or breastfeeding, because during hormonal changes, again, what happens is the number is not stable. So it is important that you're not breastfeeding or pregnant. And most importantly, when somebody comes for a LASIK surgery, we do a scan, which is basically like a safety test. It is called as a corneal topography. Now, on doing a corneal topography, we will know if the test. So that will tell us if a patient is fit for LASIK surgery or not. So if you pass a safety test, and if you're over the age of 18 years and you have a stable power for the last 1 year, then you're a good candidate for a LASIK surgery. Now, let us understand some benefits of LASIK surgery. Because of the advanced technology, the LASIK process as such is very quick, and there's absolutely minimal or no discomfort during the procedure. And like we said, these are permanent. Uh, this is a permanent correction, so you have a long-term vision correction, and it has an improved quality of life. Where, like I said before, you have complete freedom from your glass or contact lenses. Where early in the morning you don't have to look for your glasses, and the success rate of LASIK is more than 95%. Where patients have achieved, some patients have achieved better than normal vision. Some patients have gotten exactly what the vision was before with the glasses. So again, this is one of the most commonly asked question, doctor, is LASIK safe? Yes, LASIK is 100% safe. It is an FDA approved procedure, and because of the more advanced technologies that are coming, we see the safety and the quality and the results as such are very enhanced. Now, it is important that LASIK is performed by an experienced surgeon, and both here, when it comes to LASIK, it is important that the surgeon is experienced, along with which the technology also is advanced. These two play a very vital role when it comes to safety. Complications after LASIK surgery is extremely safe, and even if some side effects or complications do occur after LASIK, it is not vision threatening, and it could be small side effects, which we'll be talking about in the next few slides. And these side effects, even if it does happen, it can be corrected. Now, the most important like we just spoke about, is the safety test that we do, which is basically a corneal topography. So what we need to understand is not everyone is suitable for LASIK surgery. Only those who are suitable, only those who pass the safety test are the ones who are actually eligible for laser surgery, and only on them is where we perform the LASIK surgery. So what are the life changes happening after LASIK? Of course, you have an improved quality of life with clear vision. Like we said, now celebrities or sports stars where the glasses or contact lenses is a hindrance, for them it is life changing. And patients with very high number like -5, -6, or -10, where their vision is almost like less than 1 meter, they cannot see anything. For them, again, it is life changing. And like we said, the recovery is very quick, and the discomfort is very minimal. Now, the advantage of this is the patients can actually get back to the normal routine from the very next day. So you get the surgery done on Saturday, from Monday you can actually get back to work. And of course, most of the patients undergo LASIK because they're not very happy. They're feeling less confident because of the glasses. In such patients, of course, confidence in vision correction, they'll feel really happy. And like we said, patients who are into sports or driving, or who want to do some sports activities as such, where because of glasses, like for example, one of my patients recently wanted to do scuba diving, but again, they could not do it because of the glasses. Such patients, LASIK is again an ideal procedure, and this also has a positive long-term satisfaction with results. So let us understand how the LASIK surgery is performed as such. Now, basically, LASIK uses an excimer laser, and like we said, basically we need to remove some amount of corneal tissue, and we alter the shape of the cornea so that these light rays are focused exactly on the retina. Now, when the light rays are focused on the retina, is when you're able to see clearly without any glasses. Now, the entire LASIK procedure is basically done without any injection, and this basically is done with topical anesthetic drops. So these eye drops are basically anesthetic drops which basically numb your eye. Now, as soon as you put the eye drops, your eye becomes numb. Now, throughout the procedure, which normally takes less than 10 minutes, the patient's eye is numb and they do not feel anything. Forget about pain, you not even feel the slightest of the discomfort during the procedure. Once the surgery is done, now the surgery procedure. You come, you get the surgery done, and you can get back home. The next day, the doctor will see you, and from the very next day, you can actually resume all your normal activities. Drops will be prescribed for you. The drops has to be used for 3 to 4 months after the surgery. So this is just to understand the structure of how the eye is. As you can see, the cornea, which is the front surface of the eye, is where the LASIK is basically done. Now, we're not entering to the eye, we're not touching anything in the eye. The LASIK surgery itself is only on the superficial surface. It is the cornea, which, as you can see, is a transparent structure, where in the cornea, some amount of tissue is alter the shape of the cornea, you to able to see clearly without any glasses. This is again one of the types of LASIK procedures. As you can see in the picture A, the cornea, we make a small flap. As you can see, a small flap is raised on the cornea. If you can see in the picture B is where the LASIK, the excimer laser beam is given out of the cornea to alter the shape of the cornea. Once it is done, then we reposition the flap, as you can see in the picture C. This flap basically sits back onto the cornea, and this heals within 24 hours. Don't require any sutures, you don't require any glue, and this heals on its own. And from the very next day, patient can get a normal 6x6 or a 20x20 vision and can resume all his or her normal activities. So let us understand the technology behind LASIK. Now, LASIK uses a combination of various technologies ultimately to reshape the cornea and correct the vision. Now, LASIK, now we have first generation, second, third, and now even the fourth generation LASIK has come. These are the various types of lasers that are available. As you can see in the slide here, we have the excimer laser, we have the femtosecond laser, we have the microkeratome, which is basically a blade that is used to make a flap like we've seen in the previous picture. A femtosecond laser is a laser where the flap is made without the use of any blade. The laser itself will make a flap. A topographer and a pachymeter again are the equipment that is required to do the screening for a patient, where, like I said, the safety test that we do, basically the topographer and a pachymeter will tell us if a patient is suitable for a LASIK procedure or not. And in case the patient is suitable for the LASIK procedure, it will tell us which procedure is ideal for the patient. So let us understand the success rates of LASIK. Like we said, it has a very, very high success rate of more than 95%. In fact, in your complete body, the most successful and the most gratifying procedure as such is the LASIK, because of the most advanced technology, and patients are able to get the normal 20x20 vision within 1 day. It has a very high satisfaction rate with very minimal risk and the long-lasting results for the majority of the patients. So LASIK surgery timeline. So first what we do is when a patient walks into our OPD, basically we do a complete assessment of the eye. We take a complete history of the patient that are having any health conditions, and we do a complete comprehensive eye examination along with the topography, which will determine if a patient is suitable for laser or not. Once the assessment, everything is done, then the patient takes a date for the surgery, and on the day of the surgery, normally we ask the patient to take a head bath and face wash and come, because for 2 weeks we do not want any water going into the eyes. The procedure as such completes within 10 minutes, and the patient can leave the hospital on the very same day. And like I said, the recovery is normally within 24 hours. So patient has to come back for a checkup day 1, 1 week, 1 month, 6 months, and then yearly once we just do a general checkup. Now, the two things that are most important while getting a LASIK surgery done, it is the surgeon and the equipment that is used. Now, the importance of choosing the right surgeon, the expertise ensures basically precise and safe surgery. Experience leads to better outcomes and fewer risks, and personalized care for your unique vision needs. Basically, now the chances of any complication occurring during LASIK surgery is extremely rare. It is less than 0.2%. But even if it does happen, you need to be in the right hands there. If something happens, that the surgeon should be able to manage the complication. So one of the most important question or very frequently asked question is, doctor, is LASIK painful? A lot of patients do not get LASIK done is because they think it is painful. The answer is a big no. LASIK is absolutely painless procedure. Like I said, during the procedure, we put anesthetic drops, which will numb your eyes. So most patients feel nothing during the procedure. And even post-operatively, there might be some discomfort, which will be there maximum for about half a day or 24 hours, for which we normally give the drops or painkillers for that. So let us understand some side effects. Now, the LASIK, the success rate is more than 98%. And like any surgery, surgery can have its side effects. Now, there are some side effects that can happen with LASIK surgery in less than 2% of the individuals. That is dryness of the eyes. Even if dryness is there, normally we give lubricating eye drops, where you have to use lubricating eye drops for 3 to 4 months. Some patients can complain of glare or halos. Some patients can have some blurred vision or sensitivity to light. So these side effects, even though it is rare, it can happen. And another big benefit of LASIK surgery are these side effects. Even if it does happen, these are all can be rectified. There are different types of refractive surgeries, not just LASIK. Now, initially, it started with PRK surgery, which is basically photorefractive keratectomy. And then we have the LASIK. Then we have the advanced procedure of LASIK, a customized procedure of LASIK, which is Contura LASIK. And then we have the SMILE surgery. And then normally, like I said before, not everyone is suitable for the laser procedures. So PRK, LASIK, Contura, and SMILE are the 4 different types of laser procedures. In case a patient is not suitable for the LASIK procedure because of very thin cornea, or if the number is very high, like -8, -10, -15, -20, some patients have even power of -30 also. So such patients, LASIK is not possible. For such patients, the ideal procedure is ICL. ICL is a short form for implantable polymer lens. It is nothing but it's just like a contact lens where permanently we'll keep a lens inside the eye. And again, the results, the safety is just as LASIK, and the patient can resume the normal activities, can see clearly from the very next day. So imagine a patient is having a power of -10 or -20 where we cannot do LASIK surgery. In such patients, ICL is the ideal surgery where we keep the lens and the patient is so happy that from very next day, they're able to see clearly. So let us bust some myths about LASIK. Myth one, a lot of patients think that the results of LASIK are only temporary. Doctor, how many years will LASIK last? After I get the LASIK done, after how many years again I have to wear the glasses? The answer is, sorry. So the answer is no. The LASIK results are permanent. This will last a lifetime. LASIK again, like in my first slide, I told you LASIK is going to correct your distance vision. So distance vision lifelong, you will not require any glasses. Now, number two, is LASIK painful? And does it have a long recovery time? I think we've already answered this. LASIK is not painful. It's an absolutely painless surgery. And the recovery time in LASIK surgery or in SMILE or in ICL, the recovery is only 24 hours. In case you're opting for a surgery like PRK, the recovery time is only 7 days, 1 week. So, doctor, then they ask myth, LASIK has a very high risk of complication and side effects. The answer again is no, it is not. In fact, in your body, the most safest procedure is the LASIK surgery. The chances of side effects or any complication happening is less than 2%. Again, because of the advanced technology that we have. And number two is, even if there are some side effects that can happen, it's all treatable. So you really don't have anything to worry about. So myth number 4, all LASIK is the same. Just go for the cheapest. Again, no, all LASIK is not the same. There are different types of LASIK procedures like the PRK, that is the first generation. Then we have the LASIK second generation. Then we have the SMILE. Now, what you need to understand is that once we do the safety test, first of all, we will know that if you're suitable for laser or not. In case you're suitable for the laser procedure, the doctor will also guide you which procedure is suitable for you, for your eyes, because every individual, every eye is completely different. So the doctor will suggest you which procedure is best for you, and then you can get to choose. The laser does all the work. It doesn't matter what doctor I get. That is not correct. Again, laser does most of the work. That is correct. But again, it is important that you are in the right hands. The chances of complications happening during LASIK surgery is extremely rare. But even if something does happen, it's important that you are in the right hands and safe hands. So once again, thank you, Easy Treatment. I'm sure think we're getting a lot of questions in the chat box. I'm here, so I'll be more than happy to answer any of your questions regarding LASIK surgery.
Actually, we are seeing there are some questions on chat. So please, doctor, would you please answer this question first? Then we will allow others people to ask any question.
Okay, so yeah, I think first question is what is 6 by 6 and what is 20 by 20? Now, 6 by 6 and 20 by 20 is considered as a normal vision. So that is basically we take as a reference when somebody walks in, we see what the vision is. So 6 by 6 and 20 by 20 is considered as a normal vision. Any recurrences? The basically now the chances of the side effects happening after LASIK surgery is extremely rare, less than 2%. But there are some instances where we have seen some patients after 5 years or 10 years getting small amount of number like 0.5, 0.75 back. So recurrences can happen, extremely rare. When recurrences do happen, we don't know what the exact reason is, and if recurrences do happen, a retreatment is definitely possible with LASIK surgery. So can you do laser for long sightedness? So LASIK is basically done for both short sightedness and long sightedness. However, the results for minus number, the short sightedness are very, very good in that of the comparison of long sightedness. But yes, LASIK can be done for both short sightedness and long sightedness. I have glaucoma and my specs number is minus 1.5. If I do laser treatment, is it safe? So LASIK can be done on patients with glaucoma, but it is more important. Now, glaucoma basically means that the eye pressure is like how we have blood pressure, we have pressure in the eye. So if the pressure is high, that can cause any damage to the nerve, that is glaucoma. So it is important that we need to see if there's any damage to the nerve. It is important that we need to see if your eye pressures are normal. If your pressures are normal, then yes, you can go for LASIK surgery. LASIK will not have any effect on the glaucoma as such, but it is important that if you're a patient, known patient of glaucoma, that you continue to use your eye drops regularly. What precautions we should take after surgery? Now, post surgery, the advantage of LASIK is the recovery is quick. So normally the recovery takes only 24 hours. From the very next day, you can actually resume your normal activities. Now, most important precautions are for 2 weeks, we do not want any water or dust entering your eyes. So no head bath, no face wash for 2 weeks. And the drops will be prescribed to you by a doctor, which you have to use for about 3 to 4 months. So it is important that you use the drops regularly and come for regular follow-ups. Results kitna 100% hai kya? See, the thing is, what you need to understand is now the LASIK surgery, it is FDA approved, it is safe, and extremely safe procedure. But no doctor, no hospital can give you 100% guarantee. Not just LASIK, any procedure, nobody can give you 100% guarantee. But the advantage of LASIK is that if you pass a safety test and if you clear the safety test, it's absolutely safe. So really nothing to worry about as such. Sir, my site is not stable. Am I suitable for LASIK? Now, the thing is, normally the site becomes stable around 18 to 21 years. So after 21 years, normally the site becomes stable for everybody. So after 21 years, you might see small fluctuations of the site 0.25, 0.5. That does not mean your power is not stable. Like how your height stops to grow, even your power also stops to increase after a certain age. So if you still feel your power is not stable, ideally I would recommend you to wait for your power to stabilize and only then opt for a LASIK surgery. Last 5 years before I did LASIK surgery, but no, I'm facing a vision problem, so I can be able to do LASIK again. See, the thing is, after undergoing LASIK surgery, why you're facing vision problem, it is important that you get evaluated first. It could be multiple reasons. Number one reason could be because of your screen time. If you're having a lot of screen time, and that itself can cause a lot of dryness, especially now during COVID time, because of online classes, Zoom meetings, the screen time has increased for everybody. So we see more than 30 to 40% of the population in our country are suffering from dryness. So this could be one of the main reasons for your blurriness. I would recommend you to first get evaluated, first understand why you're facing a vision problem, and then take another step forward. LASIK can be suitable for plus numbers like +5. Yes, LASIK can be suitable for plus numbers and minus numbers. Again, we will know if you're suitable for LASIK or not only if you get the corneal topography done, which will basically determine if you're eligible for laser or not. Insurance में हो सकता है क्या LASIK? So again, what we need to understand is LASIK is basically a cosmetic procedure. So not all insurances cover for cosmetic procedures. If your number is more than -5 or -7, or you can just check with your insurance if LASIK is possible, and if your insurance team says yes, then yes, you can get LASIK done. Above the age of 48 years can go for LASIK surgery. So normally LASIK is surgery that can be done at any age. There is no age limit, upper age limit for LASIK surgery. But what you need to understand is that after the age of 40 years, 45 years, we all get reading glasses. So even if you do undergo LASIK at the age of 48 years, you might have to wear reading glasses. So if you're okay with that, then yes, you can undergo LASIK at 48 years also. If both eye numbers are different, then is it suitable? See, what you need to understand is normally for everybody, almost everybody, that the eye numbers are different in right eye and left eye. Both the eyes, we have a dominant eye. So one eye, the vision is better. One eye, the number is also different. So yes, even if your numbers are same or different, and if your number is stable, and if you pass the corneal topography or the safety test, you are suitable for LASIK surgery. Good afternoon, sir. I have eyesight for one eye only. So what precautions to take and how to recover? There are patients where they have sight only for one eye. Now, if you're having sight only for one eye or both the eyes, it is important that you wear your glasses. Of course, one eye will have power and one eye will have. There are no additional precautions that you need to take, and you really don't have to worry about recovering eye as such. It is normal to have sight even in one eye. Only thing is just go for a periodic or annual eye checkup regularly. So Rajesh, I am present at 23 years. My sight is not stable. How long should I wait for stability? See, Mr. Rajesh, at normally 23 years, the power should stabilize. Normally, patients, even if they feel like the number has changed by point, like for example, your power is 2, next checkup you go, it is 2.25. That does not mean your power is not stable. Small difference of 0.25, 0.5 is very normal. That does not indicate that your power is not stable. 23 years, ideally your power should be stable. So I would recommend you to get a LASIK evaluation done. And if you're okay, if the doctor says you're fit for LASIK, you can go ahead with the LASIK surgery. You really don't have to worry about its stability. What is the main reason behind eyes becoming dry? Okay, that's a good question. So basically what happens is in the LASIK is basically done to the cornea or the front surface of the eye. Now the cornea or the front surface of the eye basically has a lot of nerves. It's a very sensitive part of the eye. It has a lot of nerves. So basically in a LASIK surgery, because we are making a flap and we're removing some tissue, so the nerves also become damaged. Now, once it becomes damaged, it has to regrow again. So during this process is when, because the our nerves are getting damaged, the eye sensitivity also reduces. This ultimately leads to dryness. But again, dryness post-surgery is temporary. You really don't have to worry about it. Even if you don't have dryness or you do have dryness, we recommend you to use lubricating eye drops for a period of 3 to 4 months. Plus and minus sight actually shows what effects on your eyes. Basically, we need to understand there is something called as a short-sightedness or a long-sightedness. Short-sightedness means basically a patient is able to see everything clearly at a short distance and not able to see clearly at a long distance, which is the most common type of error. So when a patient is having short-sightedness, we give them minus power. Plus or basically is given for long-sightedness, where patients are able to see clearly at long distance, are not able to see clearly at a shorter distance. So for such patients, we give a plus number. So plus is given for long-sightedness and minus is given for short-sightedness. So short-sightedness is myopia, long-sightedness is hypermetropia. What is the cost of LASIK? I think you can get in touch with the team. I think they'll be able to guide you regarding the cost of LASIK surgery, because there are different types of LASIK surgeries and that you can get in touch with the team. I think they'll be able to guide you. Has anyone gone blind after LASIK? No, absolutely not. So that is what we're trying to tell you. LASIK is absolutely safe. Even in the worst case scenario, nobody can ever go blind after undergoing LASIK surgery. Worst case scenario, you might have some side effects like glare or halos, which are again correctable. These are only temporary. The main advantage of LASIK is even if you do some patients who get a power back again, it can be recorrected. So we don't see any long-term side effects after LASIK surgery as such.
Okay, excuse me, doctor. Actually, I'm requesting to all of you, anyone wants to ask a question, just unmute yourself and ask directly to the doctor. So we will get the better answer in between.
So
Or
if
in-
I'm not eligible for LASIK, do you offer other laser vision corrections? So yeah, so basically LASIK is one type of refractive surgery. Now, not everyone is suitable for LASIK surgery. So basically after doing the scan, only 50 to 60% are actually eligible for LASIK surgery. So because for LASIK, we require a lot of, require a good adequate thickness of the cornea. So those who are eligible for LASIK will do LASIK. Those who are not eligible for LASIK, we have options like PRK, that is photorefractive keratectomy. PRK can be done in even in thin corneas. And those who are not suitable for PRK because of even more thinner cornea or whose power is very high, like -8, -10, -15, -20. In such patients, ICL is the ideal procedure. ICL is nothing but it's called as implantable columnar lens, where permanently we'll keep a lens inside the eye. The lens remains in your eye, and we don't have to remove it. And from the very next day, patient will be able to see clearly. How many years we can use spectacles for eyesight? For example, if you want army or police, there's one person should not wear spectacles. How to reduce eyesight? Uh, I'm not able to follow your questions, but I think I understood. So basically, I think you wanted to say that if you're planning to get selected for army or police officer and you have spectacles, basically those who want to get into army or those who want to get into police academy because of the classes, normally if you're not getting selected, ideally PRK or Epicontura, this is the procedure that is available at our center. We do this procedure and the recovery takes between 1 to 3 weeks. So after 3 weeks, you can go for your medical selection. So yes, Smile or Contura, which is best and effective procedure? Thank you for asking. See, the thing is, Smile or Contura are different types of refractive procedures. These are all customized procedures. This is the third generation and the fourth generation LASIK surgeries. Basically, what you need to understand is every patient's power, every patient's eye is completely different. So after doing the scan, first of all, the scan will tell us if you're eligible for laser or not. And in case you're eligible for the laser procedure, it will tell us which procedure is ideal for you. So ideally, I would recommend you to visit a center which offers all the procedures under one roof. So if you go to the center and then they will guide you, because some patients smile is good, some patients contra is good. But as such, both the procedures are FDA approved and both the procedures have excellent results and very high patient satisfaction rate. Is LASIK painful? No, LASIK is absolutely painless procedures. It's a very soothing procedure, in fact. Now, LASIK procedure as such, the entire process takes less than 10 minutes for you to and get into the operation room and get out. And within 24 hours, patient is able to see clearly. Once we put the anesthetic drops, the eye becomes completely numb. So it's not just the pain, patient does not even feel like we've touched their eye. So they just have to lie down, they can just listen to some soothing music, and the surgeon will keep talking to the patient can talk to the surgeon, and the entire process will last less than 10 minutes. So as the person has undergone previous eye surgery, she or she eligible to undergo LASIK surgery later. So it depends what eye surgery the patient has undergone. If you're saying that they've already undergone a LASIK surgery and they've again got the power back, if that is your question, then means that not so basically if they've already undergone a LASIK surgery and they want to go for a resurgery again, it is possible, but again it is important that the thickness is sufficient for us to do a recorrection. So recorrections after undergoing a LASIK surgery is possible. In case the patient has gotten the power back and if the power is stable, yes, a recorrection can be done. And again, for that we need to do a test to see if the thickness is sufficient, and then we can do a recorrection. What are the adverse effects of LASIK? I think we just spoke about. So LASIK, post-LASIK adverse effects are very, very rare. It happens in less than 2% individuals, but some individuals we do see some patients having some amount of dryness. We see some patients having some amount of glare or halos. Glare or halos means when you're driving at nighttime, you see vehicles coming from the opposite end. You see a small circle around the headlight. So these can happen, but if it does happen also, it's only temporary. These can be rectified. And some rarely we see some patients having photosensitivity, or some patients after 5 years or 10 years we see some patients developing small amount of power. So in such instances again the recorrections can be possible. So adverse effects, even if it does happen, it can be rectified.
Miss Asma, you can ask question. I have just opened your tweet. You can ask directly. She's waiting from starting.
Yes, please. So I have compound myopic astigmatism -8 diopters in both eyes. So normally, if your power is high, like -8, we can tell you if you're eligible. There are two options. It could be LASIK or ICL. We can only tell you after undergoing the scan. So if you have good amount of thickness, yes, -8 can be corrected with LASIK. But if your thickness is not sufficient, then you can go for a PRK surgery or an ICL, which we can tell you after undergoing the scan. Will I need glasses after surgery? No, you do not need any glasses after surgery. In fact, we recommend you to wear sunglasses after the surgery, maybe for 6 months or so. Ideally, you can buy some polarized sunglasses and you can wear sunglasses after surgery. And you don't need any computer glasses. And the whole point of surgery is for you to reduce your dependency on the glasses. So the whole point of LASIK is to get rid of your glasses. So definitely after the LASIK surgery, you do not require any glasses.
Any other person who wants to ask any question, please continue. You can ask your question in any respective language.
Yeah, we have one more question, I think. I have astigmatism. Is LASIK possible for me? Yes, LASIK is possible for myopia, is possible for hyperopia, and it is possible for astigmatism. Especially if your astigmatism, LASIK is a very good procedure because the results of LASIK is far more superior, and the vision results will be much better than what it is with your spectacles as such. Again, it is important because we are getting a lot of questions asking if LASIK is possible for me, LASIK is possible for me, I have this power, I have that power. LASIK is possible only if your power is stable, number one, if you're above the age of 18 years, number two, and number three, most important is if you pass a safety test, a test that is available at any LASIK center. It is called corneal topography. So if you clear the test and if your power is stable and if you're above the age of 18 years, LASIK is possible for you. Yes. Any more questions?
Please, I am seeing someone has raised your hand. Please allow Sunny, please allow her. Or please you unmute yourself.
What about post LASIK ectasia? So basically, a post-LASIK ectasia is a condition where some patients have a habit of constantly rubbing their eyes. So what happens is, on rubbing the eyes, the tissue becomes thin. Now, when the tissue becomes thin, we see that patients are developing some power again after surgery. So it is important that normally you don't rub your eyes after surgery, and when you keep rubbing your eyes, you're getting high the astigmatism, and in such patients, you see the cornea becomes very thin. So to avoid that, eye rubbing is something that you should not do. And most important is post LASIK ectasia happens when the surgery that we're doing on patients who have thin corneas. So now, because of the advanced technologies that have come, where the instances previously, if you see 10 years or 20 years, we used to see patients of having post LASIK ectasia, which is one of the very rare complication of LASIK. But that is something that we don't see that often now because of the advanced technologies, because we're able to tell who is suitable for patient, who's suitable for LASIK and who's not suitable for LASIK. So I have my power in different sizes, and I will be eligible for LASIK. Yes, even if your power is different in both your right and left eye, your power is 2 and 2.5. See, ideally, most of them have different power in their eyes. Even if you do have 2 or 2.5, if you're passing the corneal topography test, then yes, you are eligible for LASIK surgery and you can get LASIK done. So power is normally not same for most of them. Have squint can go with LASIK. Yes, you can go with LASIK. Ideally, if you're having squint and if you're having spectacles power, we recommend you to undergo LASIK first. Wait for a few months and see how the squint is. And even after that, if you still feel there is some amount of squint, then you can undergo a squint surgery. What is the line of treatment for pingicula? So pingicula is basically a condition where you get a small pimple around the corner of the eye. This normally comes because of dust. It comes because of sunlight. And ideally, to avoid pingicula to increase or to avoid getting it, it's best when you're going out to sunlight, you wear a UV protected sunglasses like a polarized sunglasses. And the best line of treatment for pingicula is you can use some artificial tears like refresh tears. These are over-the-counter drops you will be getting at any pharmacy. And pingicula normally comes because of dust or dryness or sunlight exposure. So you can avoid these three things by wearing sunglasses and using lubricating eye drops.
Okay, we have some special offer for our webinar attendees. You can get just free LASIK screening, and you can also get free consultation, doctor consultation. So you have to do what you have to do. You have to just call on the same number 900-000-1766 to book your appointment or any kind of additional help, advice, treatment, or any recommendations. Our committed staff is available to give you the assistance and direction you require. We look forward to serving you and continue our journey towards better health together. Thank you, doctor. You have given the very nice insights over the topic. And thank you all of the people who have joined and making this webinar fruitful. Thanks again.